This is something parents, aunties, uncles, grandparents think a lot about, and we talk a lot about kids' mental health, but the numbers show just how common these struggles really are and why parents can't afford to miss the warning signs. The CDC says about 1 in 5 U.S. children ages 3 to 17 have been diagnosed with a mental, emotional, or behavioral health condition. Breaking that down, roughly 11% live with anxiety, 8% with a behavior disorder, and 4% depression. But here's the challenge. Only 20% of children with mental, emotional, or behavioral disorders ever receive any kind of care from a specialized provider. So we wanted to get some context and analysis on this important conversation. Dr. Stephen Palte, Chief Medical Officer for United Healthcare of Georgia. Thank you for coming on. I know this is a very important topic. So start with, why do parents and children so often have such different perspectives on a child's mental health?
Good morning. Thanks for having me. Well, I think, obviously the children see things differently to the parents, and often the children can feel that they are being pressured by the parents to conform to certain schedules, and that can lead to a lot of friction. So it's really important that that parents listen to their children, meet them where they are, really try and understand what's going through their minds, and try and come to a compromise to try and help them. And obviously, if that is not if that is not successful, then obviously there are resources, lots of resources, starting with the pediatrician or primary care physician, who can really help guide the parents and the child to the necessary care.
So what are some of the early warning signs that parents should really be keyed in on, especially ones that might be really easy to miss?
Well, certainly any kind of behavioral changes, if your child is starting to be a little bit more withdrawn or starting to act out, and that's not really normal for them, that's certainly something to think about. Also, if you notice that at school that the schoolwork seems to be dropping off a little bit, or they don't want to participate in sports, or they're not doing their homework, those can all be signs that there is some underlying behavioral health issue.
I think a lot of parents probably want to talk to their kids, but struggle to get that conversation going. Maybe when they do, a child might say, hey, you don't understand. How can parents respond in a way, or even initiate a conversation that keeps the door open and really gets the ball rolling into a productive conversation that could lead to some help down the road?
Well, really listening, a lot of time parents, as I say, tend to have their own ideas, but just sitting down with with the child, and, just having an open forum, having an open mind, and saying, that it's a safe space, that, you're going to try and discuss and work through these issues, and if necessary, seek professional advice to try and overcome the problem. Another good avenue is, if there is issues at school that could be affecting this, speaking to the teachers and the counselors at the school can also help, and they can also give very good guidance.
Oh, that's a great point. Kind of bringing that team around a child can be helpful. From your perspective, what do you think is the biggest barrier to early detection? Because if you can talk early and get support early, it doesn't have to progress so much. Do you think it's awareness, stigma, access to care?
Well, certainly stigma is one thing, but I think awareness is a very big issue. We're all busy in our lives, and as parents, we have our jobs, and we're trying to take care of the household, and sometimes we tend to just not be aware that there's an issue. There may be some mild behavioral changes that may go unnoticed, or some change in behavior, change in schoolwork. There is obviously a stigma, but I think that is improving. And it's very important that when children go for their primary care visit and their checkups, that this is something that is addressed by the physician, and make it a safe space for the child to talk and open up. Sometimes if for the teenagers, it's often that the parents are asked to leave the room, so that the child can really be honest with the provider to try and get the necessary assistance.
Yeah, that's a really good point. And you also just talk about the speed and the busyness of our lives, not just as adults, but especially as kids get a little older in those teenage years. It can feel like ships passing in the night sometimes. So making time for those conversations. How would you say it would be most effective to sort of make this interaction that's so key part of everyday life within, support systems between family members and kids?
Well, I think, schedules are very important. If you have a set schedules, especially meal times, having set meal times and having the whole family sit down together, that's often a very good forum that, children and the parents can sort of speak freely and have time to discuss some of these issues. As you mentioned, ships passing in the night, we all get so busy that sometimes our kids sort of eat on their own, we eat on our own, and we really don't have that time to sit down and communicate. Communication and those open channels of communication are vital to trying to solve the issue.
Yeah, finding the time whenever someone can, depending on work schedules and school schedules and everything in between. Dr. Stephen Palte, thanks so much for the insight. I know these are conversations that we hope will continue to happen in households all over our community.